going to keep the conversation going, particularly in the Hammanskraal area, because we know that it's not just impacting the community. Hospitals, healthcare facilities, they are also suffering from this ongoing water crisis. We're going to speak now to Democratic Nursing Organization of South Africa's Bongani, Mazibuko. Thank you so much for your time and joining us for this conversation. We're going to hone in particularly on the situation at Jubilee District Hospital. It's a hospital that services thousands of patients per month, but crippled by this ongoing water crisis. What is the impact on patient care?
Good day, Veronica, and thank you for having us. It has been a crippling challenge that the hospital has experienced, but from the updates that we have received from our shop stewards on the ground, is that the hospital, working together with the department and the municipality, they've made some strides in that they've got boreholes that have been used of late, and there has been some kind of improvement compared to what we had when we faced at a similar time last year, even when there was that outbreak of cholera. But nonetheless, it is important that there should be continuity. And as the previous leader was saying in the interview with the community member, there's a problem of continuity of the water. So the important thing is that the water supply should be sustained, and it should be at the level that the people will be able to continue using it. Because the way it is currently, it is definitely going to interrupt services. But as I'm saying, it is not to the level that people had experienced last year.
But we're getting reports from our reporter on the ground who was there earlier that it's gotten to a point now where patients have been told to bring in their own water bottles. They are using their own money to purchase water, something that should be a basic necessity within a hospital. I mean, that's, to me, crisis level.
No, definitely. I think those whereby there are such issues, they should be reported, and the hospital management needs to do something about it, because, as I'm saying, we were following up with some of our shop stewards and nurses who are working in the facility, and they are disputing that people are being... So we said that, well, then in those cases, those people who are telling patients to bring their own water, or their patients are being forced to purchase their own water, then those people should be taken to task and disciplined, because the hospital is the one that is responsible primarily for the patients while they are there, to make sure that those patients receive water which is clean. And they cannot then be saying that patients should go and get their own water whilst they're using public facilities. That would be unacceptable. And it's as you're saying, it's an unacceptable practice. What are we saying about those patients who would not be in a position to afford to can purchase water for themselves? Because that would then be discrimination as well. And it's an infringement of the most basic human rights that we all have and we should exercise.
All right. And I guess it also falls part of the conditions of the hospital as well. Have there been any reports so far in regards to the risks of infections when it comes to the unreliable supply of water at Jubilee Hospital?
No, definitely. Hence, I was saying initially that we need to have a sustainable water supply to that particular facility. For as long as the water supply is not sustainable, there's always a risk of infections, as we did previously, typhoid and all other infections. We don't want to get to that level whereby people are dealing with infections and they're running a risk of getting infected while they're coming to hospitals to get treatment. So it's important that we are on the lookout. The Department of Health has got safety mechanisms in place, and if they are not, then they should also be taken to task. We do believe that there's been a change in management. We don't believe, we know it has happened. There's been a change of management in the facility. And we are working hand in hand with the department to make sure that we are holding them accountable, to make sure that our members are working in a safe environment and the patients are getting the kind of care that they deserve and should be getting from the Department of Health and Gauteng.
Yeah, and I want to bring in your members as well. We know that often when there is situations like this, particularly when it's ongoing, it does take a knock on the morale of some of the staffing members there. Talk to us a little bit about what has been expressed by those belonging to the union in regards to the working conditions at Jubilee and the morale as well.
Well, the morale has always been a challenge, not just at Jubilee, but in most of our facilities in Gauteng. I think as DINOSA, we are on record having raised the issue of shortage of staff and overcrowding in the facilities. And those are just some of the things, And then when that is coupled with inconsistent water supply, then it becomes an even bigger problem that the staff need to deal with. But currently, the biggest challenge that the staff are having is that you've got a shortage of staff, and then you've also got those staff members who are completing their community service, the nurses in particular. And there's no clear indication from the department whether they're going to be employing them or not. But we do believe that engagements should still ongoing between us and the department to ensure that they absorb those nurses or they appoint those particular nurses, because they cannot afford to let them go. We are already having, the department is already experiencing a shortage of nurses. So now if they're going to let go of any of the nurses that are there, then it is going to dampen the morale of the staff even worse, because you can't be saying that with 20 people, we're expected to see 100 people, but then we want to now let go of 5, that 15 people must continue seeing 100 people. That is not going to happen. It is going to definitely affect service delivery and affect the morale of the staff that are there expected to give the delivery, the service to the people of Gauteng.
And let's talk a little bit more long-term. You've spoken about, of course, the efforts to try and get a supply of water at Jubilee. We know that there is the use of boreholes, water tankers, and those conflicting reports that we've heard from some members speaking about the fact that patients are being told to purchase their own water. What is the long-term solution in regards to a hospital like Jubilee, particularly as we're seeing those efforts to clean up the water supply of Hammanskraal, that phase 2 taking place, but still not necessarily... Yeah.
Sorry about that. I think what needs to happen is that this is a collaborative effort that should be taking place. You need the Department of Water and Sanitation together with the municipality and the Department of Health working together to ensure that infrastructure is put in place to ensure continuity of water supply to the hospital, and not just water supply, but clean water supply that should see the patients being able to use the water that they're getting in that particular facility. And we also want to see the people of the community of Hammanskraal being given the amount and the type of water, the water that is clean as well, and that they're able to have faith in, not to have people now opting to use the money from their own pockets, their hard-earned money, to go and purchase water, which should be given by the government. So in essence, we need the 3 spheres of government to come together and make sure that they are working together for the benefit of the community members and the patients who are at Hammanskraal. And ultimately, we cannot keep having the one sphere or the one department blaming the others for their shortcomings. They are all to blame, because they all need to come together and make sure that the people of Hammanskraal are getting the service that they deserve.
All right. Well, thank you for that update. Democratic Nursing Organization of South Africa's Bongani Mazibuko there speaking to us about the situation at Jubilee District Hospital.